And so because we are recording, please be cognizant of sharing any personal or protected health information, either verbally or in the chat during today's meeting. Our team is going to be managing questions in the chat panel. So if you would please type those in as you have them, we will try to get answers to you as quickly as possible. We are working on getting a copy of today's slides posted to our website as we speak. So those might not be available for you just yet, but will be soon. I will put that link for you in the chat so that you can grab those when they are available. And if you are listening by phone only today and not in the video portion of the meeting, you can still participate by pressing *6 to mute and unmute your phone, or press *9 to raise and lower your hand to be added to the queue. And Zoom does provide a version of closed captioning. So if you click on the live transcript button at the bottom of your screen, you can either turn that on or off. And with that, I will turn it over to Julie Riskin to start us off.
Good morning, everyone, and thank you for being here. My name is Julie Riskin. I'm the co-executive director of the Colorado Cross Disability Coalition and a proud Medicaid client. So we've got a number of things on our agenda today. We're going to talk again about the public health emergency unwind that we keep saying is coming, and then it keeps not coming, but at some point it's going to come. So we'll probably sooner, we're probably getting closer to it. So we're going to talk about that. Then Bonnie's going to go over some things with the Office of Community Living, both what has been accomplished and what will be accomplished. We'll then go into, it says federal compliance and innovation, and we'll talk about what that means in English. We'll talk, it's about the Department of Justice settlements and some issues around about what the feds want us to do and how we're going to do that. And then we have a special guest, my friend Shanta, to talk about Spinal Cord Injury Awareness Month, and I hope to talk about her awesome program. And we'll end with program updates. We'll pause for questions, especially if we see them coming through the chat in between things. But we're going to start with the public health emergency unwind with Rachel Reeder from the it says Policy Communication Administration Deputy Office Director. Rachel knows stuff, so I think that's a simpler way to say it. And before we get to that, just because since we're talking about eligibility, I just wanted to make sure that everyone's really, really clear that the TABOR refunds, the $750 or $1,500, depending on if you're one or two, does not count for Medicaid eligibility, so no one needs to worry about that. Not that it would matter right now, but even if it did, that's not income. You don't have to report it to anyone. You can do what you want with it. So I just wanted to make sure everyone knew that, and the state did put out a memo to that effect. So with that, I will turn it over to Rachel to talk about this unwind that we've been hearing about for a year and a half now.
Thank you, Julie. My name is Rachel Ryder, and I, as Julie mentioned, I'm the Deputy Office Director for Policy Communication and Administration. And we have been talking about this unwind for years now. So we have some more detail now and some operational questions that have been answered by our partners at CMS. So with that, let's go to the next slide, please. Okay, so the big question that everybody keeps asking, and we'll just let you all know kind of where we're at here. So we did not receive our 60-day notice that the feds promised us. So we do fully anticipate that the PHE will be extended yet another time for the full 90 days. So that would lead us to a January 11th end date that we're looking at and operationally working towards. Of course, that can change. That can be extended again, but really looking to that November 12th date as that next 60-day notice. So once we know, we'll let you all know. We'll update our website. We do update our PHE planning website every time a formal extension is announced, which usually the feds do that about 2 days in advance of the end of the current PHE. So that'll be in mid-October that we'll update the website formally and link to that formal extension. But again, we do fully anticipate that this will be extended another 90 days and get us into January, and it may be extended again. More to come. Next slide, please. Okay, So many of you know about the continuous coverage requirements. That is critically important. It has meant that Medicaid has grown in all states that are accepting that enhanced match for the public health emergency. So our caseload, as you know, has grown, and our enrollment has grown over the last couple years. That continuous coverage requirement is part of the eligibility unwind. When we think about the eligibility unwind, I'll talk a little bit about some other elements that are important that'll change at the end of the public health emergency too, that are beyond just the eligibility kind of provisions. So we are anticipating taking that full 14 months to do all of the eligibility redeterminations. So rather than some states are going to try and cram it into just a couple months, we're going to take the full time that CMS will allow us to make sure that we focus on renewing everyone and following up with folks that are eligible, making sure that we have smooth transitions in coverage for folks who are no longer eligible. And so that's kind of at a high level the plan. And I think the next slide is a visual. I won't spend a lot of time on the visual, but just to show you kind of what it looks like over 14 months. So next slide, please. So if you're looking at kind of operational details, and of course we'll post this after the webinar, so you don't have to strain your eyes to look at the detail on this slide, but it basically shows kind of when the public health emergency, if it ended in January, what that cycle would look like with renewals every month. And the 14-month cycle allows us, as many of you know, to look at the current renewal cycle that folks are on. So we're not changing up and trying to do it all at once. It'll be within your regular renewal cycle, which you can find that out on Peak, and we have some resources we'll talk about a little bit
Rachel,
later.
just for clients, renewal is their new word for redetermination. So just for people who are wondering what a renewal is, they used to call it redeterminations. Now they're calling it renewals. It's the same thing.
Thank you, Julie, for clarifying that. Really appreciate it. So we are looking at over the 14 months, kind of kicking off in December. That first kind of batch of communications would go out to the folks that would renew in February or be up for what we used to call redetermination, and some message testing is shown. Renewal is a helpful way to refer to it. So we'll make sure that we'll use the words that you all want to hear. So we are looking at that 14 months, starting really in December with the first communications, and then going through the next whole calendar year. But of course, these dates will shift based on when the actual end of the public health emergency is. So I'm going to get off this very busy slide and move to the next one. And this will be posted, of course, later for folks to look at. So what we've been doing to get ready, we've been working to really bolster the eligibility workforce in the counties, make sure that they have the resources they need to process the renewals as they come up. So we know that this end of the public health emergency might result in additional calls to call centers, additional work for counties. And so we've worked on budget requests and supplementals over the last couple years, and then we've instituted two other kind of things that should help with the end of the public health emergency: an overflow processing center, and then the consolidated return mail center. And I won't spend a ton of time on those. We have some FAQs up on our website on both of those options, but they are helping us get ready and help county workers towards the end of planning for the end of the public health emergency. Next slide, please. So some key operational goals that we're looking at the end of the public health emergency is that member continuity of coverage, smooth transitions for those that are no longer eligible of coverage, and then really trying to minimize the impacts on eligibility workers so that they can get the work done in a timely manner at the end of the public health emergency. And that's part of the 14-month strategy too, is ideally it's that cycle is what they're used to, and it won't be a bunch of folks all at once. It'll be spread out over time. So I won't read everything on this slide, but I just wanted to make sure you understood our goals are really to make sure that those who remain are eligible and they go through the process, remain on coverage, and are those that aren't, that might transition from Medicaid to CHIP, that they have a smooth transition there, or those that might transition to Connect for Health coverage, that they have and understand what that process looks like and have the opportunity to transition to other coverage. And then let's move to the next slide. So our communication approach, and that's kind of the team that I oversee is the communications team, and they've been working on and really thinking about with other states, how do we make sure that folks know when to take action, that we're not driving fear early by saying you need to renew right now and your renewal might not be up until month 10. So we've been trying to think about with other states approaches that that will help us all through this, and thinking about helping our partners understand all of the moving pieces and providing them with tools. And I'll talk about a toolkit here in a minute. So really our approach is to leverage that existing annual cycle. As I mentioned before, those notices, those what we're calling renewals, that will be at a cadence that folks have been used to. Some states stop doing redeterminations altogether during the public health emergency. We've continued that through our process, through the public health emergency here in Colorado. So we're a little bit ahead of some other states who haven't done any of that. The other piece that we're thinking about is we really want to be respectful and meet members where they are. So if you prefer to receive electronic communications, we're doing some outreach to make sure that we have that contact information, that email, if that is the way you prefer to receive communications. If you prefer the in-person, that those options are available. So really understanding what the communication preferences of our members are, and then building communications and outreach around that preference in communications. And then leveraging partners, as I mentioned before, and I'll show you a slide here of some toolkits that are in development and coming soon, that will hopefully help all of our various partners who are really interested in helping make sure that this is a smooth process and that everybody stays connected to coverage that they're eligible for, making sure that we have some tools that help folks through that process. So the phase toolkits is on the next slide. So can we please move to the next slide? Thank you. So we're thinking about this in kind of 3 phases, and nationally, the Centers for Medicaid and Medicare Services are kind of looking at 2 major phases. We added one in the middle here to make sure that we were doing some education around, we have a new look and feel to our renewals. We have some folks who have questions about that packet. And so we're trying to create some resources to do more education around what that new packet looks like, what you have to do, the signature requirement, because that's new for our state to come into compliance. And so we're going to be releasing that middle toolkit, preparing for renewals, which it really has a partner focus, and then some member-facing videos will come out a little bit later on that particular preparing for a renewals phase. So we'll share that with this group as soon as it's available. Right now, we're doing some refining of that based on some data that we're getting back on renewals and the major questions folks are asking. So we want it to be a robust resource. The Update Your Address campaign, thank you for many of you have been helping us with this over the last several months. We launched in April. We're seeing some traction with that now. We're seeing upticks in address changes and refinements and adding emails and other things from our members, other emails and other adjustments to contact information since we launched that campaign. And we'll continue pushing that because that's important to make sure that we have the right information to connect with folks. So that Update Your Address campaign is up, and it'll keep running really throughout the end of the PHE, but really a huge focus on that through potentially December, assuming a January 1 start again of the PHE unwind. And then that preparing for renewals is something that we really have heard from folks that they need, and so we're working on that toolkit now. And then the last phase will launch 60 days prior to the end of the PHE, and it will have more kind of urgent messaging and very targeted to when folks are up for their renewals. And so it'll talk about transitions in coverage and other things in that last toolkit, but it won't launch until actually 60 days prior to the end of the PHE when we know we're going live with that. Next slide, please. Thank you. And these are just some previews of some of the materials available on Update Your Address. So you can see some of the visuals here for Update Your Address. And then let's move to the next slide. And then these are some of the new tools we have in development, some visuals. We're looking at a kind of 3 parts to this next toolkit. There'll be some videos and partner toolkits on these 3 major themes: the Update Your Address, how the renewal process works, made for stakeholders that aren't eligibility experts and other partners who want to understand kind of what the process looks like for members. We have sample notices that'll be included in that, so folks understand what that looks like. And then that last tool about transitioning and the work with Connect for Health, that'll be part of that phase, that last phase that launches, and we'll be working on that transition language and some materials with Connect for Health that'll go in that last part of the toolkit. Next slide, please. Okay, so this is an opportunity. We would love to get some ideas from everyone on this call, and feel free to reach out to me. I think my contact information hopefully is on the last slide. If it's not, it's my first and last name at state.co.us. I'll put it in the chat. But we're really looking to make sure that the toolkits resources are robust, are useful. We have sample emails, we have sample text messages for folks community partners who leverage that tool. We have different kind of social media graphics for various social media platforms. We have some FAQs, other things that we've thought about for the toolkit. But if there's something very specific that would work in your location, or you think would be very helpful given your perspective of and reaching folks where they are, please let us know so we can make our toolkit more robust. We have some sample language for folks who might be calling in for call centers to make sure there's consistent information being shared. So if you want to throw your ideas in the chat, that's great. I know Bonnie told me I didn't have a lot of time because you have so much content to get through, but would love your ideas. If you think about, throughout the rest of this presentation, ideas that we might want to consider in our outreach, in our communication toolkit, in the various methods that we're using to reach folks, please let us know so we can make those resources just as robust as possible. So thank you for that. Next slide, please. Okay, and then these are a couple of resources where we'll be posting all of the toolkits, the various information. We have an Unwind, I would call it a website hub, but it will have, when the federal government formally extends the public health emergency, we post those formal notices there. We have some FAQs there about the timing of the public health emergency. We'll post kind of all of our resources there with tabs for members if you want to get into kind of member-friendly information, for providers, and for other stakeholders and partners. And we have our toolkit currently, the Update Your Address toolkit, posted on that particular page. And then beginning this fall, we're going to launch into quarterly community stakeholder webinars. So we'll have community partners on one webinar, and then one will be focused on eligibility workers, kind of in the weeds eligibility workers. So those will launch this fall, and then we'll continue them quarterly throughout the Unwind period, and then launch our member newsletter, our community partner newsletter, that'll be monthly. So we can kind of have a communication vehicle to make sure that we're pushing out information in between those webinars. So more to come on that, and I think that I will pause and hand it over to Bonnie or Julie if there are questions.
Yeah. Thank you so much. That was a ton of information. I don't see anything in the chat, but if people think of questions, please, let us know. And I'm wondering if maybe people can start, just sharing this information with peers. The other thing I'd ask is that if if people are doing their renewals or they're noticing notices that are wrong, one of our concerns is that we think there are a lot of people who are disabled who are in non-disability categories who will not be rescreened properly if they're not showing as disabled. So if you're seeing anything, we're getting some reports of stuff showing up in Peak that's like years old. Please share that with CCDC, because we're working with folks on the CBMS end and the eligibility end to make sure that we clean those things up. Now rather than during the crunch of things. So even though it doesn't matter right now what it says because you can't get kicked off, we really need to know that so we can work on fixing it sooner rather than later. If people think they're on buy-in, they should be getting a monthly notice that says you owe, like a bill that has a $0 amount. If you're not getting that monthly notice with a zero premium, then you're not on buy-in. And so if you think you should be, that's something else to let us know so that they at least have the right boxes checked, so that when they're looking at your income, they're looking at it in the proper category. So with that, I will hand it to Bonnie.
Great, thanks so much, Rachel and Julie. That was a ton of information, but I think really important for us to have early and often. And I think if we're reading the tea leaves, we actually think the end is in fact near, and that January will likely be our date. So I would just echo Julie's asks that if you can share this information with peers, I think the more we understand the implications at the end of the public health emergency, the better positioned we will be to respond. So again, thank you. All right, if we can go to the next slide, please. All right, so once a year, I try to take some time to pause and reflect on all of the things that we have accomplished in this past year and really vision set for what we can expect moving forward. And, because we're a government agency, I know most of the time people do that in the new year. We do it at the end of the fiscal year as sort of a reset. So for us, July 1st is a pretty big date. So we can go to the next slide. Before I dive into sort of all of the great work that has happened this past year and provide a frame for where we are heading, I want to start with, why are we doing all this work, right? We have an extraordinary amount of work streams aimed at improving long-term services and supports and the system in which they are provided. And, when I talk with people who receive services, their families, advocates, providers, it really boils down to three things that we must problem solve for. One, we have to make sure it's far more streamlined and easy to access services and supports. One of the phrases that I often hear when working within the community is that it feels like it takes a college degree to navigate the system, and that the responsibility for navigating that system fits so squarely on the people that need the services. And so we must problem solve for that. So I think you will see a lot of our work streams are aimed at just simplifying the process to access. But surrounding that is making sure that once you get into services, that you can actually receive them. And so I think you'll see another portion of our work streams really aimed at how do we make sure that across the state of Colorado, we have high quality services available to people that is certainly responsive to their needs, but also their preferences. And of course, on the other end of that spectrum is we can have all the providers in the world, but if they can't hire staff to render the services, then it's not helpful. So I think the other really key area of focus for us is making sure that we have a skilled workforce, and skilled not in your traditional like home health perspective per se, but that we're really focusing on the direct care workers, that we're making sure they have the tools that they need to be successful in their careers, and that we're really elevating this industry as being a sort of at the forefront of what people consider when they're looking at different type of healthcare industries. So I just want to ground us in our future state. If we can go to the next slide, please. So if we can take just a look back over this past year. So on that same trajectory of, really looking at those direct care workers. We really have had significant investments in that particular workforce at $160 million ongoing to raise the base wage from what was an average of $12.41 to $15. And yes, friends, I know it's not enough, despite that extraordinary investment. And of course, we have a series of work streams aimed at really understanding how do we create a career path for people? How do we make sure that if people want to stay within being a direct care worker, that they have opportunities to grow within that position? And how do we better understand how to make this a viable career? So looking at total compensation, just not hourly wage. Of course, we received, approval of our ARPA spending plan. I believe we were the first state in the nation to get both approval from our legislature and the third state to get approval from CMS. So really hats off to all of you for helping us do that. We have completed the enrollment process of 500 people into the developmental disabilities waiver, which of course provides 24/7 supports for people with intellectual and developmental disabilities. We finally received federal approval from the Centers for Medicare and Medicaid Services for our final settings rule in our state transition plan. I'll talk a little bit about that in the coming slides. And we have codified our rule in Colorado. So after 9 years, we are full force moving forward with the implementation of that final settings rule. And then we were one of a few states that were awarded an additional $5 million to better support our Money Follows the Person's program. Next slide, please. So I talked a little bit about the direct care workers, but we've had unprecedented rate increases for HCBS. So while we used, a lot of our money in that ARPA spending plan really towards helping us understand what are the solutions to problems that are before us and making sure that we have strategies in the medium and longer term to create new programs or payment methodologies. We also dedicated one-time rate increases to home and community-based service providers to make sure that they could be more flexible in responding to the economic changes in Colorado. $243 million this past year we have infused into the home and community-based service system. I think the other thing that's really important to know, I am secretly a bit of a data nerd, and I was really worried that, given the rapidly rising cost of workers and, just the extraordinary challenges that are facing both providers, people who receive services, that we would have this decrease in enrollment. And when I look at, enrollment growth in programs over the past 5 years, what I can see is that we have had steadfast increase is specifically in the programs that serve people with the most complex needs. So I talked about the enrollment into the DD waiver, but we've also had a massive enrollment into our Children's Habilitation Residential Program CHIRP waiver. And that's a really big deal because let me tell you, prior to expanding the eligibility for that program, we were sending a ton of kids out of state to get services. We were putting kids in foster care when that really wasn't needed. And so I had to have triple the enrollment in that program in particular really means that we're doing a better job of keeping kids in their homes and in their communities. We've also had some really great enrollment in our program that supports people with brain injuries. This has been a waiver program that has been really hard to build up the provider capacity to best support that community. And we have seen, 15-16% increases in enrollment over the past few years. And then last but certainly not least, I know folks don't love electronic visit verification or EVV, but I want to tell you, you all are really, really good at it. For those of you that do self-direction, so CDOS or IHSS, you're probably really closely connected to the federal requirements around electronic visit verification. Otherwise, I hope your providers take care of it for you and you're not deeply, deeply connected to what's required. But we've finally implemented our electronic visit verification system, and we have a 98% plus compliance rate, which is just unheard of nationally. So thank you all for helping us do hard things and helping us do them well. Next slide, please. So I talked a little bit about what did we do this last year. We did some extraordinary things. This is where we're focusing in fiscal year 22-23. So we need to put our head down and really focus on steadfast implementation of the American Rescue Plan Act, that spending plan. We have 63 projects within there really aimed at strengthening, expanding, or enhancing our home and community-based services initiatives. And that, of course, just isn't waiver services. That includes long-term home health, private duty nursing, behavioral health services. So, and we have while we have a small extension to do that work, it is a small extension. And so we are very, very focused on successful implementation of that plan. Next up, we are going to be focused on federal compliance in this next year. I have a few slides that are coming up that will speak to the Department of Justice findings that we had in March. And our role right now is to really lead cross-agency efforts to remediate those findings. And of course, I finally, after many, many years of looking at how we can redesign case management here in Colorado, I see the light at the end of this case management redesign tunnel. And so in this next year, we will be putting requests for proposal out and really move forward into the implementation phase of what we have been crafting as a vision over the last few years. And Amanda will speak to what we're hoping to accomplish there. And then, of course, as I spoke about, we are really hyper focused on the direct care workforce. So over the past few years, we have developed an action plan in collaboration with many of you, in collaboration with direct care workers, on what is it that we need to do to address these critical shortages. And so we are now in the implementation phase of that plan, really making sure that we have the right wage increases, training, and access to new technologies. And then last, we are also very focused on skilled nursing facilities in particular. That industry, I would assert, has been perhaps most significantly impacted over the last few years. And we want a plan that makes sure that we have, right now, stabilization and quality, but that plan leads towards, transformation of that industry.
Bonnie, there is a question in the chat about a timeline around the direct care workforce, and the person said they have 150 people in the county not getting homemaker or personal care because of lack of staffing. So as you're going through addressing stuff, if you could answer that, that would be great.
Yeah, staffing, I see Candace's response there, and staffing is really, really, really hard. And so, Stephanie, when we said, we invested $160 million, which is unprecedented in my last 10 years, ongoing funding, it's not enough. So it really will be an iterative process. We're looking at things like qualifications, we're looking at things like wages. So, every year we are working closely with, I think, the community to look at, what are the strategies, the budget and legislative strategies we need to move forward to help us move that needle, while also working really closely with our case management agencies on, how do we leverage, service delivery options like, say, self-directed options like CDOS or IHSS to help close those gaps in the interim? How do we, capitalize on workforce, potentially maybe untapped workforce as a opportunity to make sure that people continue to get their care needs met? So this is my way of saying I don't have a magic wand or an easy answer for this one. It will be iterative, and we will have to continue to really work community by community on how we close those gaps. If we can go to the next slide, please. All right, so I did answer that question around workforce, or please, at least sort of elevated the challenge that you put in the chat. Are there any other questions before we move to what's next? All right, Julie, if it's all right with you, I'm going to keep us going. All right, so federal compliance and innovation. Julie's like, that's really bureaucratic language, Bonnie. So right now, what I am focused on here is looking at how, when we're looking at compliance with the Department of Justice findings, which I'm going to talk about just here in the next few slides, how we can make sure that in any solution we're being innovative, that we're really driving towards change that is impactful for Colorado. I think really in any problem, there's an opportunity, and we don't want to miss that opportunity to do something new and different here. So if we can go to the next slide, please. So just to make sure we all have the same foundational understanding, in March of 2021, the Department of Justice issued a findings letter to the state of Colorado. And in that findings letter, they said Colorado is in violation of the Americans with Disabilities Act by administering our long-term care system in such a way that unnecessarily segregates people with physical disabilities in nursing facilities. And you can imagine that this was a pretty devastating finding for us. You know, I think at the core of the work that we do here at Healthcare Policy and Financing, it is making sure that there is high quality services across the continuum, and that people always have a choice to live in their homes and in their communities. So if we can go to the next slide, please. So in those findings letters, the DOJ highlighted there's 4 main categories that they really want us to address. The first one is, how do we stop people from going into a nursing facility to begin with? How do we make sure that they have the right information if they're considering going into a nursing facility? How do we make sure that they understand what options are available to them in the community? And then secondarily, once somebody is in a nursing facility and they say, you know what, I want to move back to the community, how do we make sure that process really is effective and streamlined and, in an expeditious way helps that person achieve that goal? So moving from the nursing facility back to the community. And then the third area where they want us to focus is really looking at the services that we have available within the community and expanding them to make sure that access to providers isn't a barrier to transitioning from a nursing facility to the community. And then the fourth area of focus that they would like us to look at is really increasing access to integrated housing. So if we can go to the next slide, please. So I love me a good roadmap slide. So this, I want to catch you up in terms of where we are today, because there is many months between March when they issued the findings letter and today. So, the 15-page letter that's public on the Department of Justice website is the same letter I received. And so I think without any additional information about what their investigation told them, I wanted to make sure that as we are working with the DOJ to come up with solutions to the problems that they've identified, that the stakeholders in our community agree that we're solving for the right problems. And so I met with key leaders from across the state, about a dozen or so, and just said, tell me, if you have a magic wand with these 4 areas of focus, what are the changes that you would make? I then took that feedback and developed some internal teams of subject matter experts and asked them the same questions and provided them the feedback from the community. What we realized really early on is that we would need some immediate resources to really help us be quick and effective in our response time to the Department of Justice. So last session, we were able to pass House Bill 22-1302 that allowed us to get some immediate resources so that we could effectively do the work of remediating those issues while also developing our longer term plan in collaboration with our stakeholders and the Department of Justice. So I have the potential ideas from that and first group of stakeholders. I have the subject matter experts weighing in. And so we are at this point now going out and doing broader stakeholder engagement, saying, here's what we know, here's the feedback we've received, is this the right strategy? Now, concurrent to all of this, I am engaging with the Department of Justice on what a remediation plan might look like. So if it feels like I'm being opaque in any way, certainly not trying to, but we want to make sure that we are very, very responsive to what they found. And so that really requires for us some concurrent pathways. So we will gather that information from our stakeholder engagement. We'll continue to work with the DOJ, and then we'll come back to stakeholders and say, okay, we think these are the right solutions as we move forward here in Colorado. Next slide, please. So we understand that stakeholder engagement isn't the best way for everyone to provide feedback. So we have provided a link to a survey, and I would encourage you all to fill that out, maybe to spend some time with those 4 areas and give us your feedback on where it is that you think we should be focusing and what solutions are most important. Feel free to share that survey wide with maybe other folks in your network. And again, it's about a 10-minute survey. So thank you so much for engaging with that. Next slide, please. All right, so next up, I want to highlight for you all that the final settings rule is finally being implemented. So in March of 2024, CMS implemented a final settings rule, which required some really basic rights to be implemented in any setting that is considered community. And this is things like being able to have guests in your home, access to food whenever you want it, making sure that you have a right to privacy, which includes things like having locks on your doors. So, you know, especially in residential or provider-owned settings, you know, I think there was a propensity for those settings to lean towards more institutional. And so this final settings rule really created a bar for what must be included, what rights must be afforded to people in any setting that is required or that is categorized as a home and community-based setting. They do require at a state level that we demonstrate compliance with every single setting. So this is not just providers. This is across every single, you know, individual residential program, day program, post-home setting. And I think they realized that there was no way we were going to do that in 5 years. So they issued an extension, right? First, it was from May of 17. They then went to March of 2019. And then they moved it to March of 2020. And then, of course, what happened was the COVID-19 pandemic. And they recognized that demonstrating full compliance in the middle of an unprecedented pandemic was unlikely. And so they moved that out to March of 2023, 9 years after the initial rule was published. And so the time is now. If we can go to the next slide, please. So what we are doing is we sent provisional letters to providers and said, look, we are going to be issuing letters to both providers and the people who receive services and their guardians if they have them, that if you're not demonstrating full compliance, I want you all to know that you may get a letter saying your provider's not in compliance with this final settings rule. We will create a process where, you know, we can have informal reconsideration, providers can reach back out and provide that documentation. However, in very, very rare circumstances, if that provider fails to demonstrate compliance, they can no longer be a Medicaid provider. In that, again, very, very, very rare circumstance, that would mean that a person would have to choose a new provider that did demonstrate compliance. So our final date is March of 2023. So we are working hand in hand with providers to make sure that we achieve that requirement. Next slide, please. We also have, this just gives a link to a series of rights, especially around rights modifications. These are really great to share with people who might have right modifications in place. Thank you, Max, for putting those in the chat. Next slide, please. And then we also created a community integration tip sheet. So there's a new resource sheet if you're a provider and struggling to come into compliance. This hopefully will help both provider agencies and direct care workers brainstorm with individuals on how to really come into compliance. Next slide, please. All right, I'm going to pause here and hand it back to Julie.
Yeah, I'm going to just keep moving it along. I did want to just make sure people understood that this doesn't mean that someone with a developmental disability cannot choose to hang out and have friends who also have disabilities. That was that's been misinterpreted in the past, and that's not what it means. But I want to make sure that we get to, we're not going to get through our whole agenda today, I can tell, but I'm really excited to introduce Shanda Hinton, who's the Executive Director of the Shanda Center for Health and the Shanda Plan Foundation. And I just got to visit the Center for Health recently, and I was so impressed and excited. It is an amazing place, and if you can get to Lakewood, I would strongly suggest people go check it out. But I will turn it over to Shanda now. You're still on mute. There you go.
Hi, everyone. I am so grateful to be a part of this conversation. Thank you for having me join. I want to be really effective with time. I know that you guys have a lot to cover. I am, as Julie said, the executive director of the Chanda Plan Foundation, as well as the Chanda Center for Health. I am also a Medicaid client, proud Medicaid client, as well as a woman living with a spinal cord injury. My personal story is that I was injured when I was 9 years old. I was accidentally shot in the back of the neck between C5 and C6. So spinal cord injury awareness and being a part of that community is very important to me. Approximately 17,000 individuals are injured every year. While I am proud of the spinal cord injury community, I am also very proud that that is connected with a variety of disabilities, and ensuring that when I take my personal story and I look at being a part of the advocate community, I know that it takes everyone in terms of the variety of disabilities that exist in our communities to really make services, awareness of services and access to services. Based on my personal experience, I just wanted to share that, you know, access to services, waiver services, as well as community services that were created through, you know, my personal experience, as well as the advocate community, as well as the department and along with the legislation. And so when I was injured with my spinal cord injury, I really had to reevaluate how I was defining and taking care of my spinal cord injury, as it was very reactive versus proactive. And so I also wanted to evaluate the cost versus quality that was existing within my healthcare living with a long-term disability. And so as I experienced chronic pain, opioid addiction, which I was able to use medical intervention to save my life, I really needed to look back at, like, how could I have prevented that? What are some things that we could implement for the future? And that really led me to participating in integrative healthcare, which is acupuncture, massage, chiropractic, and a lot of other services as well. So upon my participation in that and the impact that it gave to me from a financial perspective, saving dollars for lots of emergency room visits, 911 calls, I also looked at the quality of my life and how much more productive I was in terms of being able to feel proactive in social activities as well as employment. And so with that, I really wanted to have a conversation about what does access to this type of care look like in the current state as well as in the future state, knowing that future state in a systemic level while paralleling that with something that's current with donor dollars was really important. So that's why we started, myself and the community started the Chanda Plan Foundation. And our first effort was creating, back in the day with a lot of, again, advocates in the department and legislation, is the spinal cord injury waiver in 2009. Just in 2020, we were able to renew that waiver and expand it to be statewide, as well as adding other disabilities. Because again, it was very metro in spinal cord injury. By expanding it, we're able to really serve more individuals with disabilities, which again was kind of my initial introduction about all disabilities are really essential to focus on. It's now called the Complementary and Integrative Health Waiver, which I really love and enjoy, because I do like that we're starting to name waivers after services rather than disabilities, even though sometimes it's easier for case managers and communities to identify and connect with those waivers. I do see that we're shifting that that direction and conversation to be more about the services. And with that, we also created the Chanda Center for Health. And so while we looked at these services and the advocacy and the access for current and the future, what we also started to notice was that as Bonnie was talking even about providers and how much providers are in community, but even though we have a lot of providers, it doesn't mean they're always qualified to serve. And so one of the things is that while we created the waiver to really provide that access, we also realized that individuals weren't able to access providers that had a level of disability cultural competence. And so we had no expectation of becoming a provider of a service that we advocated for, but it felt like the natural thing to participate in, because we knew that we were able to really look at the access, the accommodations, and the accessibility that individuals deserve upon enrolling into any type of service or waiver. And with that, we at the Chanda Center for Health, when an individual comes into the center, they come into a place that feels very therapeutic, which I think that one thing is that within the healthcare system, we should always be looking at how do people define and connect to healthcare in terms of how it feels, but also from the accessibility and accommodations. We wanted to ensure that we were creating an environment where individuals felt as though they could access all the services without having to go into a place and advocate, well, I'm here, you're meant to and designed to serve me, but yet when I come in here, I'm advocating, because all day individuals with disabilities have to advocate for their accessibility and needs, and it's oftentimes very exhausting. So if we can eliminate some of that for the folks that we serve in a healthcare setting, we wanted to ensure that we did that. And so at the center, individuals are able to get onto treatment tables with trained providers around transfers, using the ceiling lift, doing manual transfers in a safe way, and so that individuals with disabilities don't continue to experience health disparities for the sake of lack of understanding the population and having providers being scared of something that they're just unaware of. And so those are all of the components that I really wanted to share with you about myself, the Chanda Plan Foundation, the Chanda Center for Health, and sharing that in light of, again, the spinal cord injury awareness, knowing that that really expands beyond, again, spinal cord injuries to other disabilities. And I'm very honored to be a part of Colorado community, the Denver community, the type of efficiency, proactiveness, and for me, equitable healthcare that we're all doing a lot of great work on. And so I, again, thank you for your time. I may have spoke very fast, but I wanted to be very efficient and give you all the amount of time that you need for the other topics on today's call.
Awesome. Thank you. And again, I would definitely suggest checking out Chanda Center. I said I was very impressed. So speaking of things that advocates do, one of the things we did last legislative session is we passed 2 bills about wheelchair repairs, which is a continuing problem that we've all been frustrated about. One was the right to repair, and that's gotten all of the press, but the other one I think is actually might be more impactful to Medicaid clients, which was House Bill 1290. And what that did is it increased reimbursement rate for rural repair. It took away prior authorization for repair completely. And most important is it created, it authorized HCBS to create, to work with stakeholders to create metrics, because there's been really no standards for quality of repair, timeliness of repair. And Haley, who is the amazing DME staff person for HCBS, is going to talk about implementation of House Bill 1290. So I'm going to turn it over to Haley. And we are probably not going to get to anything after Haley, so the other agenda items will have to wait till next time, but they will be in the slides.
Hi, Julie. Thank you. Thank you for having me. Hi, everyone. My name is Haley again, and I manage the durable medical equipment benefit here at the department. So like Julie said earlier this year, House Bill 22-1290, also known as changes to Medicaid for wheelchair repairs, was passed. This bill focuses on CRT repairs. CRT is complex rehabilitation technologies. So this bill impacts a very specific area of DME. As of July 1st, we implemented the first part of the bill, which was allowing all claims related to CRT repairs to be billed without a prior authorization request. The next step in our timeline is creating rules that establish CRT repair metrics. At the very least, these metrics must include requirements for repairing CRT in a timely manner and expected quality of each repair. This needs to be implemented by October 1st, 2023. A stakeholder process is also needed, and we have started to plan what this process will look like and expect the formal process to begin before the end of the year. After this, we are not able to implement any other sections of the legislation until 2024. So expect to hear more updates as we continue to work through these steps. And please let me know if I can answer any questions.
Well, you went way faster than I thought. So, so that's amazing. I don't see anything in the chat. So, so Colin,
Sure.
even though I just said we weren't going to have time for you to do your thing, you now will.
Well,
you have 8 minutes. So,
I'll do my thing very quickly. So, if you go to the next slide, please, Jen. Thank you. So, as of September 1st this year, and good morning, everyone. Home health and private duty nursing have officially transitioned to the Office of Community Living. We're really excited to work with our stakeholders on that. Part of that stakeholder engagement, we're kicking off on September 29th from 1:30 to 2:30. We'll have a web page up, I believe, in the next several days. We'll also have that information going out several times with John Barry's emails. We'll be having a conversation around PDN. You can get engaged there. It'll go out sometime here in the next several weeks. Look for late September, early October, and we'll always keep you engaged in what's going on, and very privileged to be able to have these conversations and looking forward to them. I'm going to go to Amanda super quick, and then I'll hopefully have enough time to finish up here at the end.
Great, thanks, Colin. As Bonnie mentioned, we've been working a number of years to come into compliance with conflict-free case management, and with the passage of House Bill 211187 for case management redesign, we're finally at the stage where all of the conversations and discussions we've had with you and others throughout the years is starting to come to fruition. So in October, we will be kicking off stakeholder engagement around rule revisions. There's a lot of work that has to happen between now and 2024 so that we can truly align all case management activities and services, regardless of an individual's disability or which waiver program they're seeking. So we will be publishing schedule and outline of that rule revision process and engagement in the which will kick off in October, but just really wanted to make sure you all had the heads up today. Colin, I'll give it back to you.
Thank you, Amanda. And I think we might be able to do this on time. If we go to the next slide, please, Jen. So a couple opportunities to engage here. You can go to the next slide. So we really would love people to join our support and employment stakeholder meetings. A lot going on there, some really cool stuff. There's several opportunities in October and one in November. And as the aforementioned slide said, now that we've taken over the benefit for long-term home health, we'll be holding that first meeting on the 29th of September from 1:30 to 2:30. If we go to the next slide. Was really hopeful we could get to this. So these are some fantastic opportunities to be able to engage with the American Rescue Plan Act funding that we have. In particular, we have a respite care grant looking to kind of expand our access, get new providers involved. We're going to connect case management agencies to admission, discharge, and transfer with that data, understanding sort of how people are going into the system and what's happening there. I believe that's $1.3 million. And then an innovative models of care grant, looking for people to redesign, in particular, kind of pre-nursing facility types of care. So getting individuals that would normally, under the current system, go into a nursing facility, finding different ways that they can engage in their community and really be truly integrated into that level of care, supporting people in the community. And then we're going to be releasing soon behavioral health transition supports grants and digital transformation and electronic health record upgrades. We go to the next slide. And have to put out a plug, please, if you have a moment, fill out our satisfaction survey. We would really love you to be able to do this. It helps improve what what we're doing here, what we're talking about, what you find helpful, and how we can better engage, even if there's not a webinar on that particular month. Making sure that we have the ability to hear from you and then be able to put that into our slide deck and into our overall engagement plan. Next slide, please. So the next webinar actually will not be in October, it will be in November, and it will be around our American Rescue Plan Act funding and the engagement we have around that. So from 9:30 to 11, again, these are an hour and a half. We'll be going over things for this community and talking a little bit about how that impacts. We'll be having some more conversations around grants, case management in particular. There'll be conversations about ACC 3.0. And then from 3:30 to 5, we'll be talking to providers, giving some of that same information, engaging there. And then for the OCL webinars, we're actually not going to be back this year as we had put out that previous schedule. We'll be coming out with new dates here for 2023 soon. And if you have any feedback, please, again, fill out the survey and then let us know with that link. And with that, please stay engaged. There's a lot of opportunities to do so. You can email us. If you do not receive emails from John Barry, you are missing out. So please sign up if you can. And from that, I will close it out. Thank you so much for joining us this morning and have a great weekend.
Thanks, everyone.
Yep. Thank you. Thank you, Julie.